let's talk about ambulances. Montreal facing the worst ambulance shortage in months. And, it's been a while that we've been hearing about all the holes in the Quebec healthcare system. And we're used to hearing about the issues once you arrive at the hospital. But now, issues about even getting to the hospital. Let's go to Hal Newman, former paramedic and firefighter with more than 4 decades of experience in emergency health services, now writes for the Rover, joins us on the line. Hal, welcome to the show.
Good morning, Elias. Thanks for having me.
Listen, I also want to just point out off the top, you have a wonderful Twitter and your Twitter presence at Big Medicine. Love your handle, by the way, where you cover everything that's happening with ambulances in the Montreal area, the Laval area. So, Hal, give it to us straight here. What is the current situation with ambulances, paramedic availability in the area?
It's pretty critical. Of course, it was before the pandemic. The healthcare system was, speaking medically, was in critical condition pre-pandemic. It wasn't miraculously cured. And so all of the problems have been exacerbated by the pandemic. So with each successive wave of disease, we burnt out more and more of our healthcare providers. And that extends to paramedics. They're mentally and physically exhausted. On any given day, Urgence Santé is the ambulance provider for Montreal and Laval. Any given day, they're running 15 to 20% less than optimum on their workforce. So people calling in sick, that's a combination of probably a small percentage of that is COVID related at this point, but a lot of that is just mental and physical exhaustion.
Hal, for that mental and physical exhaustion, can you tell me about what the day-to-day of a paramedic has been? Like the number of hours they got to put in? Is there forced overtime? Like what is, over the last couple of years, how has it been to be a paramedic? What kind of work situation are they facing?
It's tough and it's rugged. I mean, every day, virtually every day actually, for the last several weeks, Urgence Santé has gone into what they have contingency levels, emergency plans. And when they go into emergency plans, paramedics lose their right to have a pause for a meal, and they have forced overtime. So if you can imagine being on a shift where the shift never ends and you don't get a break, and it's call after call after call with calls holding. So for the life of the paramedics it's been incredibly difficult. And then add COVID as an added layer of complexity and stress, and the fear of bringing something home from, quote unquote, from the office that your whole family can contract. That's the situation.
We're with Hal Newman, former paramedic and firefighter, and we're discussing the ambulance shortage over at Urgence Santé of late. So, Hal, I have recent experience with Urgence Santé and having to call 911. In November, I had to call 911 for my mother, okay? And she was having difficulty breathing. Let me tell you, the firefighters were there it seemed like 2 minutes. Like the firefighters were there so quickly, so someone was in the home very quickly, and then 2 minutes after that, the ambulance was there. So to me, it all comes down to care level, and someone who needs it, is the ambulance showing up in time? So
yes,
when it comes to care.
So Elias, sorry, go ahead.
Yeah, when it comes to care, what's the situation?
So the deal is they're handling high-priority critical emergencies in a timely fashion, and thank goodness for that. And I'm glad to hear your mom got excellent care rapidly. Urgence Santé depends on their first responder partners through the Montreal Fire Service, Côte Saint-Luc EMS, and Hatsula in some districts. And they're getting there for the critical life-threatening emergencies. Where it gets scary is if you're a lower priority, let's say you've fallen and you can't get up, you have some pain in your ankle or in your hip, but you're otherwise stable, and you're lying on the floor of your bathroom, and it takes 3.5, 4 hours for the paramedics to get to you. That's everybody's nightmare. I as a paramedic, I always treated everybody as if they were my family. and that's my great concern right now. Is unless the Quebec government addresses the problems with the pre-hospital care system, which they seem to be doing their best to avoid, the shortage of paramedics, which leads to the shortage of ambulances, is going to continue for the foreseeable future.
Hal, we had last week on, I believe it was Wednesday, where we had all of that ice, right? The freezing rain and then the thawing and the freezing. And we had heard at one point, Urgence Santé was like, don't call right now unless it's life-threatening. We don't have the ambulances. Obviously that's an incredible scenario that even if they had full staffing, maybe they'd be in the same situation with people falling and broken bones, that kind of stuff. But is that a main worry for you about what happens if there is something serious, a situation where you need a lot of ambulances at the same time? Do you have a worry there?
Yeah, because so the ice was an exceptional situation, and actually they ended up in a very rare situation of having a level 3 emergency, which happens maybe once or twice a year. But they're at what they call a level 2 emergency almost daily. So my big fear is if we have a mass casualty incident, which in a metropolis isn't really a question of if, but more a question of when, and it could be it doesn't have to be anything terrorism related. It could just be a really bad car wreck or an industrial accident or a swimming pool, chlorine spill. I mean, the scenarios are endless. And then you need 30 ambulances, and they're just not available. They don't have the numbers. It's not to say that they're not trying. They're trying their hardest. But there's a paramedic shortage. Paramedics have gone 2 years without their contract being renegotiated. I think the latest offer on the table from the government is 2%. So paramedics are leaving the profession in droves. So how do you make up the human capital when you're subtracting from it at that rate?
Hal, why do you think the government's made that decision here? Because, there's so many areas of the healthcare system that need help, and it seems like they've put ambulances, paramedics on the back burner. Why do you think that is?
I don't know. It's bizarre, actually. So, there are something like 73,000 nurses. There are only 5,500 paramedics across the province. So even if the government were to give them a substantial increase in pay, it doesn't a whole lot of money. For me, it just boggles my mind. I spent 40 years as a paramedic, and I lived through countless committees. And each committee they'd come out with a report, and they'd say, these are the reforms that we should have. We should have helicopters. We should have advanced care paramedics, on and on and on. And they would cherry pick one or two recommendations that look good for public consumption and it works well in an election campaign, and that's what they would go for. But they've never transformed the pre-hospital care system. And in Montreal, I just want to say, Montreal and Laval, we get rapid response for critical emergencies. But for everybody who goes to their country house, because I actually live out in Shefford, which is 45 minutes from Montreal, and I have a lot of friends who live in the Laurentians, don't kid yourself. I was looking at the response data. So if you're in your country house in St. Donat and you call for a critical emergency, it's 18 minutes for the ambulance, and that's if it's a critical emergency.
Yeah.
So we have problems right across the province. They need to be addressed, but they just get kicked down, it's like a can. They kick it down the road to the next government.
Hal, listen, we have to leave it there, but I want to thank you so much for coming on. You're a tremendous resource, by the way, for those of you who are on Twitter, at Big Medicine is where you can find Hal. And then on Facebook, do check out The Last Ambulance on Facebook for more resources and info from Hal. Hal, thanks so much for coming on.
Okay, take care, Elias. Have a great day. Be safe.
That is Hal. Same to you, Hal. That is Hal Newman, former paramedic and firefighter with more than 4 decades of experience in emergency health services.